Mark. I'm a member of the Innovation Advisory Team. I'll be monitoring our time today, and I'll be monitoring our chat. We're scheduled to go from 12:30 to about 1:10 p.m. with the presentations. The follow-up time will be question and answer. Each presentation will be about 10 to 13 minutes. This session will be recorded for future use. And so I'm going to introduce everybody here right off the bat. It is my pleasure to introduce in our first presentation, Sonali Kurup, who is an associate professor of medicinal chemistry, College of Pharmacy, and presentation will be teaching drug discovery in the context of COVID-19. And our second presenter will be Gail Bullard, Associate Professor, College of Health Professions, and we'll be presenting addressing substance abuse and opioid use disorder, a collaborative approach. And then finally, our third presentation will be Anne Breitenwischer. She is a research and instruction librarian, professor of library and instructional services. And that presentation is entitled Visualizing and Creating Information Discovery Assignments, Expanding Students' Horizons in the Global World. Thank you very much. And Sonali, you're up.
All right, thank you. So I'll just share screen here, make it full screen. All right, perfect. So thank you everyone for joining the session today and taking the time to hear me speak about teaching drug discovery in the context of COVID-19. So this is something that I worked on right when the pandemic hit. So in the spring of 2020 is when I teach an elective course titled Special Topics in Medicinal Chemistry. So this is my second offering of the same course, and it's typically it's mostly planned for the spring. It's taught in Canvas as the platform for teaching. And the format it's an elective, so it is not mainly lecture based as much. There are a few mini lectures, but there's a lot more discussion. There's literature review and assignments that the students do. As a form of assessment for student learning, I have students complete 2 exams, a midterm and a final, and then they have assignments, of course, that contribute to their grade, and a term paper. And since the course is Special Topics in Medicinal Chemistry, a big focus of the course is drug design and discovery. And so the term paper basically requires them to look up the literature, identify a particular area of interest, critique whatever article they have found, and then propose a series of compounds to address the challenges from that paper. And so there is a lot of guidance that is necessary. And, typically when you do it in class, in person, there's a lot of discussion that occurs. So pre-COVID, but the way I teach the course is in the first half of the course, I have lectures and the midterm to evaluate if they've learned the different strategies for drug design and discovery. And then the second half of the course focuses on applying it, and they apply it in the form of a term paper. Now, with the timing for, when COVID hit, we had just finished our midterm the week before that. And then the term paper is when they had to apply everything. And so, I had to rethink the way I do the term paper. And so some of the challenges, I'm going to move on to the challenges here. So firstly, distance learning is, not something that we typically do. I had never taught in the distance format prior to the COVID pandemic hitting us. And so I wasn't sure if I would be able to do this. Secondly, it was already so difficult for students and even faculty, that we were in lockdown. I really thought the elective course would be put on the back burner, because they had so many challenges that they would have to cope with. And there is some value in, being lenient during the pandemic, but I also think that, that it would also be not fair to their learning if we didn't hold them accountable, even though we were in the midst of a pandemic. And so I was really struggling with how to address this in a manner that would be beneficial to all, but not be too much for the students to cope with, and would make it more meaningful. And so, I was trying to look at different approaches. And then if you think of everybody, if they think of their experience at the time, and this was around March 15th when we were in lockdown, I mean, the news about the pandemic was all consuming. Our whole lifestyle had changed. If you switch on the news, all you hear about it is the pandemic. You would get these, even if in your social media feed, you would get information. If you talk to your relatives, your friends, it was only the pandemic. And in the initial phases, there was a lot, but there was no drug for COVID-19 at the time. And so there was a lot of discussion on how, what drug would be effective and how we would get to that point. And so instead of, while there were challenges and it was a horrible time to be in, at the same time, I tried to kind of look at it as if I could use that in some way instead of focusing on the negative, kind of use that as a positive to engage students more. And it made perfect sense. There were drug discovery efforts happening for finding a treatment option for COVID-19. And so there was no better time, and that was in a accelerated format. So there was no better time, and no, I don't think I would have ever found the time to find real world examples for the students right there while the course was going on. And so I decided then to use the drug discovery process for a COVID-19 therapeutic as an example for students to understand the different strategies that I used for drug discovery and apply them. And then again, I was cognizant of some of the emotions that the students might be feeling. If family members were suffering from COVID, or just the fear and anxiety associated with it. But so I reached out to the class. I decided, how am I going to offer this course? So I decided, instead of moving too far from what's normal, I wanted to keep the class time so the students would meet at the class time every week, and we would meet on Zoom for the duration of whatever lecture I had. And I had a 2-hour slot, and so we would end earlier if required, but otherwise it was a standing fixed thing that they had to show up on Zoom every week for the 2-hour class. And so I sought input from students on whether they would be interested in something like this. At the same time, in the media and, personally too, being from the health professions and being in the drug, part of drug discovery. So I am a medicinal chemist by training. So I understand the drug design and discovery process. And I also understand, you shouldn't be making broad statements about drug efficacy and effectiveness without having complete studies done. And so students also kind of understood that. And so there was a lot to critique as well. And so after taking input from the students, we decided to collectively embark on a term paper where the students, with some guidance from me, would research all of the different therapeutic options available for COVID. And then they would answer a series of questions. And I hope I'm not going overboard. I won't take too much more time. So just broadly, these were some questions: provide a detailed explanation of the disease state, identify a compound or a series of compounds, or propose a compound based on something that you've seen using the drug design strategies that I had taught them earlier in the course for COVID-19, and then explain how that compound would work for COVID-19. So come up with a mechanism of action for it and clearly explain it. And then also talk about its drug-like properties. So how would it really ever be able to be absorbed if taken orally by mouth? And then how would it reach its site of action? And then lastly, provide a scientific opinion. So if you think, so where is this drug with respect to becoming a drug that could be approved? So how far along the process of FDA approval is the drug? And what is necessary to get it approved? So that's the last point here. Now, typically we would have done this in class with discussions. So instead of having discussions in class, we had something similar to it. We called them term paper previews. Typically when I run my course, I run it with students doing a lot of the work in class itself. There's not a lot of homework that I give for my material. But with this, I decided that they have to do a little bit more. So you come prepared to the Zoom meeting, and then you share what you found. And they were open to that. So you identify the drug that is the focus of your term paper, you describe that to us, and then we will weigh in on whether it is appropriate or not so that I can guide you. Identify an appropriate reference, justify why it's an appropriate reference, describe drug properties, and then again, status of drug development. Then coming to results, so that was the activity. So the results of the students, so I just put in a little bit of what we found. The previews during the live Zoom class I thought were beneficial because we did have a few students who had veered very far from what was typical. And then again, some of them were looking into natural products and we didn't want that. I didn't want that for this, because I wanted something which would go through the FDA approval process. And so, that was some guidance that was necessary. This was the list. I thought it would be interesting to put the list up that the students found for themselves. When we started out, the students weren't, when I said find appropriate literature references, they wanted to make sure that they were really looking within the purview of what I wanted and what typical people in the drug discovery process consider, or health professions consider, appropriate references. And so links to those were provided to them, and then they could choose from there or go out within that framework and find additional references for themselves. And so this was the list they came up with justification. And so their perceptions of the term paper. So I surveyed them at the end of the term paper. And so before the survey, they were anyway receptive of the term paper. And so that's why we did it. 100% of them said, all of them rather, said that it helped them understand the drug discovery process. And so when I'm teaching them about the drug discovery process, being a drug discovery scientist myself, I want students to embark on a career in drug discovery. And I was hopeful that after going through this entire exercise and understanding the value of needing more drug discovery scientists and new drugs, I would have convinced some of them at least to embark on a career in that or consider that. And even though 100% said it improved their understanding of drug discovery, only 12% actually were interested in pursuing that as a career. So that was interesting. And then from the instructor perspective, I thought the activity encouraged student participation in drug design and discovery. From the learning standpoint, they seemed to appropriately apply it with some guidance. So I thought they did well. By the end of the course, remdesivir was approved. That was approved for emergency use at the time. Full approval came later, but for emergency use, it was approved. And so that was interesting. And for those students who chose, quite a few students had chosen remdesivir. So it was nice. And, we had a little bit of a conversation going on the course as well. And then lastly, the only shortcoming, I would say, two shortcomings rather, I focused only on therapeutic strategies. I did not consider vaccines at all. And so perhaps that would have been interesting. There's so much more going on in that area, of course, as we are all aware and living. And then drug repurposing, that was the only design strategy that the students employed. Nobody really came up with de novo design. So nobody really proposed a new compound. So that was a small limitation of it. And so, I really thought this would be a one-time thing, but it appears that this might be a recurring feature, at least for this year as well, when I offer it. And so I thought, I don't know if that's interesting or not, but I thought it made it a positive twist on something negative that we were all experiencing at the time. So with that, I'm going to stop. Thank you for your time and attention today.
Thank you. Yes, we go up next to Gail and her video presentation.
Okay, thank you. This is a presentation that was completed by our student workers for Chemron. So enjoy.
Hi, we are the Central Michigan Recovery and Education Network, also known as Chemron for short, and presenting today are Cassandra Falk, Raylan Fate, Elise Green, and Brianna Harlan. Dr. Gail Bullard and Dr. Scott Sexton will host a question and answer session. Built on a foundation of collaboration and community, the roots of Central Michigan Recovery and Education first sprouted in 2016 while two Ferris State University deans, Dr. Stephen Durst, Dean of the College of Pharmacy, and Dr. David Damari, Dean of Michigan College of Optometry, discussed recent articles on the opioid crisis in our nation. The two reached out to the Dean of Health Professions and the Dean of Arts and Sciences to explore how Ferris State might have an impact. This seed of information led to the development of the Rural Opioid Task Force.
The task force grew to include Central Michigan Community Mental Health, Spectrum Health, and District 10 Health Department. The first goal accomplished was to have naloxone available in each Ferris State University campus security vehicle. Then, in 2018, this group applied for a HRSA Rural Opioid Planning Grant, which was awarded in 2019 and led to the formation of the Rural Opioid Prevention Network. This allowed for further community collaboration to develop a strategic plan that would address opioid use disorder and opioid-related deaths in Mecosta County.
The planning grant, led by Dr. Scott Sexton, resulted in the successful award of a HRSA implementation grant in September 2020, creating the Central Michigan Recovery and Education Network. Cameron serves as a network whose sole purpose is to connect SUD and OUD service providers in the community. Cameron's role is not to compete with community partners, but rather amplify the services each partner provides. Our research in the planning grant demonstrated that this work reached far beyond Mecosta County, and as a result, Cameron now serves Mecosta, Newaygo, and Osceola counties. With a strong focus on prevention, treatment, and recovery, we collaborate with our partners to address identified opportunities and gaps through developing new partnerships which can amplify the service provided in the three-county area, a model that is clearly supported by our mission and values. A unique approach in the Cameron model is the inclusion of 4 graduate student workers who serve alongside Dr. Gail Bullard, Project Director, Dr. Scott Sexton, Principal Investigator, Dr. Stephen Durst, Project Dean, and evaluators Dr. Jean Elder and Aaron Espinoza. Cameron work evolves around 15 core activities outlined by the HRSA grant in the areas of prevention, treatment, and recovery. Our work has been described as ambitious, but fortunately, the network has a growing group of partners that are engaged in this work and are helping us to implement our strategic plan over a 3-year time period. For the prevention initiatives, we are working on increasing culturally and linguistically appropriate education and stigma reduction. We will also be working on increasing the access to naloxone, the opioid reversal agent. There are many avenues to acquire this life-saving medication, and we are assisting our networks in our service area to develop best practices and plans to identify persons who should have this medication on hand. We also have a focus on increasing the number of and awareness of surrounding year-round drug take-back boxes. We are partnering to increase the level of education in both the schools and in the community related to SUD and OUD. And our last prevention initiative is to standardize the ways that we identify, screen, and refer individuals for treatment for SUD and OUD. For our treatment initiatives, we have a focus on integrative care for individuals with SUD. We also want to increase the workforce that is active in SUD and OUD services. And we would like to increase the number of providers that can offer medicated assisted treatment for opioid use disorder. Our network has identified several barriers to treatment, such as copay for patients or reimbursement for providers. Additionally, social determinants of health have presented a barrier to treatment, including but not limited to transportation and daycare services. Our network is working to overcome these barriers and increase the access to treatment for all those who wish to pursue it. Our network is collaborating with local law enforcement and first responders to help integrate individuals into treatment. We have a focus on providing information to the community related to where they can find or access treatments through the use of our marketing campaign and certified health workers. And finally, for our recovery initiatives, we are investigating ways to enhance the discharge process, both in hospitals and in the jail systems, to better integrate individuals in recovery back into society. We support the development of recovery communities, both recovery residences and areas considered safe places for individuals with SUD and OUD to recover with minimal to no stigma impact. And in collaboration with our partners, we are exploring ways to enhance the peer workforce in various settings to include individuals in recovery. And of note, we have a strong support for the increase of the utilization of peer recovery coaches among various settings.
In the first 5 months of grant funding, Cameron has grown from the 4 governance partners to 14 partners. A newsletter is sent to partners bi-weekly, along with Talk About It Tuesday, which is an educational video developed and recorded by the student workers. We've supported 2 workforce education grants, 1 recovery community grant, and we've also submitted a telehealth grant application. In addition to that, we've provided financial support to place a drug take-back box in a pharmacy. And through the work of one of our partners, all pharmacies in Mecosta and Osceola County now have drug take-back boxes. Cameron is ultimately comprised of a dedicated group of individuals with deep passion for helping those who are impacted by substance use disorder. We also aim to reduce stigma and improve SUD/OUD literacy through education. At the end of this month, we'll be holding our first educational event, and we're incredibly excited about it. The event is virtual, and you're all welcome to attend, even if you cannot make it to both nights. On night one, there will be a keynote speaker addressing SUD and OUD through a personal and interprofessional lens. And then following that speaker, we'll have a Q&A panel comprised of individuals who have various personal and professional experience with substance use disorder. For the second night then, event attendees will have their choice of SUD/OUD related topics to dive deeper into through individual Zoom sessions. These will focus on harm reduction, peer recovery coaching, personal testimonies, syringe service programs, and more. We thank you for letting us reflect on the growth of our organization with you all today. From here, we hope to continue advancing and branching out our communication and connections to amplify further substance use disorder and opioid use disorder prevention, treatment, and recovery initiatives. We encourage any further questions that you have for us at this time. Again, thank you.
Thank you. Good job. And we are up to Ann. Ann, are you ready to go?
I'm not seeing Ann in the meeting.
All right. So I guess we can jump right into the questions. They're both very interesting presentations that raised lots of questions to me. I can think back to some of those press conferences during COVID and all the different things that we were throwing out there that was giving us hope and then taking away hope. So who has questions? Let's go. Well, I have 100 questions, so I'm just going to ask away then. Sonali, go ahead.
Oh, excuse me, Steve. Scott, you were muted.
I apologize. I actually had a question for Sonali. When you started the pre-work with the students in that course, what was the level of engagement, given that we had just recently gone to that virtual climate and it was quite a challenge for so many of us?
So it was a challenge, and I think it was a challenge for me too. And so I think because we were struggling through it together, I think actually my class was much more engaged than it was prior to being online, because I think there were so many, I think there was more bonding with the students in the class because we were talking about, the pandemic and then talking about the actual course content. So the level of engagement was very good. I also didn't know how to navigate the distance learning environment exactly. So I really didn't know. I didn't want to be too overwhelming because it was an elective, but I also didn't want them to blow it off. So I took a lot of their input for how I should plan it for them, where they're still doing something, it's not just a free pass, but I want them to learn about the whole drug discovery process too. And then exactly like Steve mentioned earlier, we were getting so much information from the media and, they were talking about it. And I have never had any political issues brought up in class prior to that. And it was a little difficult to handle that too. So there was a lot of engagement on very different levels. I thought that was a positive. I think teaching actually made it, being able to communicate with them on Zoom made it somewhat more, I enjoyed that. I mean, that kept it somewhat normal for me compared to, being entirely, I couldn't do it without some level of engagement. It's a discussion-based course. That's how I teach. So it was hard otherwise. I'm sorry for giving such a long-winded answer for that question.
I'm curious how your students did with the course. Did you find that the course helped them, emotionally or otherwise to talk about, or was there more despair as they found out some of these theories were pretty far out there, or what was the feel for it?
Well, the feel for, I thought, I teach in the College of Pharmacy, so it's a professional program, and so they are required to conduct themselves professionally and think according to the guidelines. And so, for us, I think some of the science had become somewhat politicized at that time, but, we had to kind of remove the politics and tell them very clearly that, these are guidelines and this is how things get done. And, it's not like, you have to be scientific at all times. And so I thought that conversation, I think they liked that part of it. So that was the non-bias, no bias, and let's be objective about it. So that I thought this assignment helped us be objective. With respect to emotional support, I didn't get too many requests for that, but I could tell that they were struggling, and one or two students did reach out to me individually just for a few exemptions here and there. I can't attend preview. Can I have an individual meeting with you? Some of our students were volunteering. There were needs for volunteers at many pharmacies. So some students could not make it to class time. So I made a few concessions there, but they had to stay on track. So you have to meet the expectations maybe on your own time instead. So yeah, it was a little different, but I thought it was interesting, and it was totally different. This was a totally new experience for me, which is why I thought I'd share it here and see what others think of it, and how it evolves as we move forward. I think there are some questions in the chat for Scott and Gail, so I won't take all of the time for questions. I'll hand it over to them.
Well, we have a lot of time, so. Are there some things that you would keep in there that you had to adapt and improvise that you said, hey, this really worked out, or was a really big surprise? I mean,
some of them were fixated on chloroquine. And so I had to, I didn't tell them outright. I kind of made them think of why I don't agree. I said, I don't agree, but I said, I want you to kind of tell me why I might not agree and why you think it's right. And so they had to then find the literature backing to support what they were saying. And then they kind of talked themselves out of it. And then there was some discussion in the class too amongst the students. And so I thought that was interesting. I felt a little divided myself, if I was kind of pushing certain ideas or thoughts that I have on the class, but I felt I wasn't, because as I have to teach them what is the proper approach to this thing and how you get a drug approved. And so I thought I was staying true to my path. So, I just kept it objective like that. But there was conversation. It was nice. I will reiterate that it was very nice, but they spoke so much about the drug options that were available. Actually, the students mentioned a vaccine. I am a synthetic chemist. I don't make vaccines. And so, I said, there's so much information out there. Let's just limit it to the ones that I think is more easily available. And, that there was a lot of discussion about. Vaccine would add another element. But I think next year when I offer it, I would maybe focus on the vaccines instead of the therapeutic options, and then we'll go from there. And then I hope this conversation ends, because I don't want any more of this, the pandemic to stay with us for this long. So.
Good. Thank you.
Gail, do you have some of your students with you on the call right now?
Yes, I do. I know Brianna is out here. I'm not sure that I see anyone else in the names that I can see, but Brianna is here. Yes.
Yeah, I'm just curious, Brianna, if you are able to talk, just what your experience was with the project and what it was like for you.
Yeah, so it's been such a learning process and extremely fun going through everything. And we're constantly doing new things, planning new events, putting out videos, marketing, things like that. If I was in undergrad, I would definitely want to do this as an internship, because it has been absolutely amazing. Right now, we are working on our educational event for next week, which is Tuesday and Wednesday from 6 to 8 p.m. This is virtual, so if you guys, haven't seen the flyer, please reach out to the Cameron email and I'll be happy to send it your way. But just planning something like that with different speakers from different organizations, professions. We even have another graduate student from the College of Pharmacy who's going to be presenting. It's been such a blast, and I'm excited to see how that turns out. But our work is ongoing. We're working on new things every day. I'm always busy, and I absolutely love doing what we do. So.
That's great. Thank you. Thank you for answering my question.
Yep, no problem.
Someone had asked about our email and I put it in the chat, how to reach out to us. And so Cameron has its own email, cmren@ferris.edu. And then we monitor that every day and you'll get back to any of us, or you can reach out to myself or Dr. Sexton as well.
Gail, how much luck have you had with the insurance companies and such getting funding for your program?
Well, it wouldn't be for our program, but for our counterparts. And one of the projects we've been working on is telehealth. Just as Sonali had to move her class to virtual, most of behavioral health moved virtual in the heat of the pandemic. And so at the time, and currently still, reimbursement for telehealth visits for behavioral health is in place because they've lifted some of the restrictions for COVID. And there are some major movements at the state and national level to have that continue. And so we've been in some of those meetings and are supportive of that. And then, as was mentioned in the video, we also have written a small grant for strategic planning to incorporate a clinical pharmacy in telehealth to work with behavioral health for SUD, OUD. But for the insurance piece of it, we are working from, we have 7 subcommittees. One of them is Recovery Communities Subcommittee. And so with that group, we are reaching out to our local, our state representatives and our national representatives, also working with Michigan Center for Rural Health, one of our partners, and another partner, Michigan Health and Hospital Association, to try to address some of the reimbursement issues that they have related to not just telehealth, but basic reimbursement at all. What we learned in a subcommittee meeting a couple of weeks ago is that behavioral health groups are required to hold to what is some of the same requirements for value-based purchasing care reimbursement. And if you're a healthcare system like a Spectrum or a Henry Ford, whatever, you have a deep bench to set up that process and monitor it. These behavioral health groups are sometimes 7, 10, 20 person groups, and they are required to hold to those same situations. And so they are having difficult time trying to evaluate that and maintain a solid base. So we're reaching out to our constituents to see how we can make some changes in that, as well as find some training and some support for them to do that. There are a large group, Cameron is one group of these recovery community grants that are across the nation, but much of Michigan is covered, especially Northern Michigan and the entire UP, and we meet monthly. So we have a deep bench from that side to help us bring these things forward as well.
Okay. It's my understanding that Ann is here now. And Ann, are you ready to go? Ann?
Are you ready for me?
We're good to go. We're good to go. We have
Okay.
105. See you about 10 minutes. Go ahead, Ann.
I'm Ann Breitenwischer, and I'm a research and instruction librarian. My background is in teaching. So presently, one of my primary assignments is the email research box. This was an innovation many years ago, and we got it as a result of applying for a grant. And since that time, I've answered questions with colleagues from many places around the world. And also, one of the big pieces of it is developing assignment guides for students. So hence the interest in the topic that you see before you. But there are many good things going on, new technologies, new pedagogies, and so on, just call for adding some new things. And now with the misinformation, disinformation, and malinformation, we have a lot to do as a university to cut through this to ensure that our students have some idea as to how to separate things out. I will mention that in the beginning, Ferris has been in information discovery and access. Mr. Ferris had a shelf of books, and he relied on community library. It wasn't until the late 30s did they have a degreed librarian on board, and this degreed librarian almost required a course of study that students would have to pass in order to use the new library facility that they had. Fast forward now to March 12, 2001, just about 20 years ago now, did we open up the flight building that you see before you every day. What we were an early adopter of the information commons concept. It was an instant hit with students. And what happened there is that, and I'm quoting, inspires users to expand their knowledge and expertise in information access, collaboration with peers, and use resulting understandings to produce new information products. So indeed, we are a teaching and learning library. On the right, I have high impact practices. Most of these are taken from George Koo's work, which has been set more than 10 years ago. I have added citizen literacy because this ties directly into the Ferris mission. And what this is a toolkit that was set up at the University of Louisville. And what they have videos, handouts, all kinds of good things that can be used in any discipline where you want to use it. And what they have included is things like news literacy, informed voting, algorithmic literacy, and they talk about lateral reading. And this is going to be very important when when it comes to evaluation of work, because students need to find more than one article that claims something or more than one source. As we know, fact checkers go for any sources that they can in order to make sure that things are correct, close to the truth as possible. So hence this concept. I'm going to point out with diversity, some of our grad students have indicated that they would like to have more in their coursework on this topic. I'm going to show the information timeline. It is not totally linear by any means. But key at the top is social media. Virtually every discipline is going to be involved in this. And because about 10 years ago or so, some were viewing the idea that peer review is too slow of a process, they created what they call alt metrics. And alt metrics will only get at the impact of articles or books or whatever. You still are going to need peer review in order to get more at the quality. The example that I'm showing is taken from CDC's MMWR, a weekly report on the 29th of January, which had to do, I believe, with COVID and the National Football League. So within 2 weeks' time, there were over 1,500 hits on Twitter. So hence much interest in this particular article by everyone who finds it useful. And then the donut on the left is a compilation of all of these places where it hits. And as you can see, the bigger piece of the donut equals Twitter. I'm going to show you Carol Coulthaw's model of information search process. This has been around too for a while, and it's basically a seminal article. The first thing that hits the eye is uncertainty, a word that you have heard over and over and over again in the last year. But for a brand new person that's experiencing an assignment or a project for the first time, gee, can I really do this? And then they start, and then not finding what they think they should be finding, then go through a process of frustration and confusion perhaps. But then once they go back to the drawing boards a little bit, well, then things become maybe a little bit more clear, and they can move on. And then once they turn the project in, it's, oh boy, a wonderful sense of relief. Uncertainty, though, in the sciences, you have to be careful, because you have to plant in there some elements, because you want students to investigate. Maybe they're puzzled, but you want these kinds of things so that they understand how the research process works. And I'm also going to mention when I'm talking about information, I'm talking about it from the text point of view, data literacy, which is becoming significant, and I'm talking about visual literacy, and I'm talking about images, because we all know that any of the above can be changed with the strike of a pen. I'm going to introduce an information discovery access assignment matrix. And the idea here is that this is a suggestion that faculty get together in departments and determine what you believe that information discovery access should be like with some SLOs. What year some of these things should be placed within a student's total experience in earning a degree. And in those discussions include a librarian, because obviously what we want to do with some of these is, okay, there's a beginning for the first year student. By the time that reach the fourth year of the program, they should be exhibiting some type of mastery. And on the left, I have included these concepts from the ACRL framework. And we are getting into deeper questions. So taking the first one as an example, authority. It is not enough just to look at an article and see that the author or authors are affiliated with whatever institution and that they have whatever degree. The question is do they have the expertise for the topic that they are trying to get out to the public, out to the world to write? So if you think about, for example, somebody that is a physician, not every physician is going to be able to write on nuclear medicine. That would be a prime example of this. Then I'm also going to show you characteristics of good real world information discovery assignments. And you can go through these, and I'm going to tell you as well that there are some assignments that can be done. I found a visual sociology photo essay and in which students figured out certain student groups, what their backgrounds were, and took photos and wrote an essay from that point. There's an assignment coming from nursing, which is the windshield experience. So in other words, the students would be going around and figuring out what a community is like. So there's all kinds of things that can be done, and I'm going to stop at that point because I think I've probably and take questions if you have them. If later on you have questions, I will be happy to take those as well.
Okay, thanks, Dan. I appreciate it. So anybody have any questions for any of the presenters? We're getting close to the cutoff time here, but any follow-ups? All good presentations. Okay, this will be available. It is recorded. We've had some good chat there on the side as well. There's some email addresses and some websites for you guys to copy if you so desire. Thank you very much for attending, and presenters, awesome job. Really, really appreciate it. And thank you.